Hi, everyone. Good evening and welcome. Thank you for joining us today for QuantumRF, a lymphatic perfusion safety assessment. I'm Megan Sweeney, Director of Digital Marketing here at InMode, and I'll be your host for today's session. Today's presentation takes a deeper dive into the science behind QuantumRF, specifically how RF energy interacts with the body's lymphatic and vascular systems. It's a clinically focused session packed with insight, especially for those treating high-risk zones or post-weight loss patients. Before we get started, just a few quick housekeeping notes. This session is being recorded and will be available on demand through InMode University, and we'll also email you a direct link to the full recording. Please enter your questions in the Q&A panel at the bottom of your screen, not the chat. This helps us manage them more efficiently and ensures Dr. Dayan can easily see what's in the queue. If we can't get to all your questions live, we'll follow up with a written Q&A summary alongside the recording. Now, it's my pleasure to introduce today's speaker. Dr. Erez Dayan is a board-certified plastic and reconstructive surgeon and the founder of Avant Plastic Surgery Institute in Reno, Nevada. He completed his training at the elite Harvard Plastic Surgery program and is a leading researcher on surgical safety, energy-based devices, and tissue perfusion. Today, he'll be presenting findings from his vascular imaging study using SPY PHI and indocyanine green and what it tells us about the safety profile of QuantumRF. Dr. Dan, over to you.
Thank you very much. Thank you all for making the time and for the kind introduction. I'm very excited to share with you some of the work we've been doing on QuantumRF, specifically focused on safety in terms of lymphatic as well as perfusion. And I think, oftentimes in the minimally invasive aesthetic space, safety is oftentimes overlooked. And doing this deep dive into the safety in terms of lymphatics and perfusion has really been very eye-opening for me. And I'm excited to kind of show you how we got to this point and what our findings have been. So these are my disclosures. And I kind of want to give you a little background information on how this came about and a little background in terms of my path. So, as was mentioned, I did my plastic surgery training at the Harvard program in Massachusetts General Hospital. And when I was there, one of the best parts of Harvard was just we had a lot of interesting visiting professors come for grand rounds. And at one of our grand rounds, we had two plastic surgeons, Chris Chia and Spiro Theodoro, who have a practice in New York City, focused on minimally invasive skin tightening, liposuction under local anesthesia. And I was very impressed with their results. Everything just made sense to me. Local anesthesia made a lot of sense. The treatment gap group, meaning that middle group of patients who are looking for some soft tissue contraction but are not necessarily interested in general anesthesia, long incisions, big operations. All of that made sense to me, and I really became excited about learning more about this technology, specifically radio frequency technology. So I just became, from that moment on, I became very interested in technology, in aesthetics, and what's going to work, how does it work, how can you improve it, what are the safety profiles for these different devices. And since then, I've published many articles in some of our major journals this is the largest series here on the upper left, on radio frequency application for the face and neck area. It's about 250 cases. Another article published in the Journal of Plastic and Reconstructive Surgery on the use of radio frequency in aesthetic surgery, as well as a number of leading books. This one on the left, published by Theme, is Liposuction of Emerging Technologies in Face and Body Contouring, as well as the Facial Danger Zones book, which has a whole third of the book dedicated to minimally invasive technologies for soft tissue contraction. And the interesting thing that really caught my attention in relation to radio frequency, first of all, it's not a new technology. Radio frequency has existed in medicine for almost 100 years. And the other interesting thing is it really touches almost every field of medicine, from cardiac ablation to pain to general surgery or with different kinds of ablations of different tumors. In the aesthetic space, it's really entered over the last 20 years or so. And there's a lot about radio frequency that sometimes gets overlooked or is not well understood. And I think discussing some of the science behind it is really key. So this is an article we published in Journal of Plastic and Reconstructive Surgery, and this graph actually is very important. This is called an Arrhenius relationship, and basically there's a time-temperature relationship. And this black curve here indicates soft tissue contraction. So what this graph says is you can get the same soft tissue contraction at a high temperature for a shorter period of time as you can at a lower temperature for a longer period of time. And so the question is, what's better? Longer period of time, lower temperature, or higher temperature, shorter period of time? Now, the other thing about radio frequency is there's different ways to deliver it. One of the places where InMode really shines, and my thought is the reason they're the leader in this space is two reasons. Number one, they have patents on bipolar radio frequency. So the InMode technologies, including Morpheus, are all bipolar radio frequency, and they allow for control of the directionality of the energy from a positive to negative electrode. All the other devices are monopolar, and therefore the radio frequency energy or the electrical current travels through the path of least resistance to arrive at a grounding pad. That's usually a remote grounding pad. So with these technologies, quantum, Morpheus, body type, face type, acutite, we're talking about bipolar radio frequency where the directionality of the radio frequency is very controlled. As I became more known in the field and presented more, there would always be usually a facelift surgeon, usually an older facelift surgeon, that would make a comment about, well, how do you know radio frequency and the heat doesn't damage blood vessels? How do you know it's not damaging lymphatics? I've gone back in after radio frequency treatments for facelifts and there's scar tissue and the planes are difficult to identify. And this is me presenting at the cutting edge meeting, and there was a very well-known facelift surgeon that made some of these comments, even though they really had no firsthand experience with radio frequency. And when you go back into the literature, there's actually a lot of conflicting reports. Some people feel that radio frequency improves fibrosis. Some people say that it leads to prolonged inflammatory reactions. And we really wanted to get to the bottom of it. This is an example of a facelift procedure where the cautery is, you can see the contraction of soft tissue. But the question is what's really happening? And so what we decided to do was actually use technology, which some of you may be familiar with, called the indocyanine green SPY camera. And as you may know, this is the most sensitive perfusion and lymphatic assessment tool available to us. It uses a near-infrared laser that fluoresces indocyanine green. And it's been used for both perfusion and lymphatic assessment. So for perfusion, it's used oftentimes in a reconstructive setting. Here on the right side of the screen, this is during a face transplant, where you can see when the vessels are reattached, you can see the perfusion coming through. Or in cases of like debridement, this is an example of a diabetic foot, you can get a very high resolution sense of what's being perfused and what's not being perfused. And the way that that works is the indocyanine green is injected intravascularly. It attaches to the red blood cells, and the laser on the camera will fluoresce the indocyanine green so you can see exactly where the blood supply is going to. It can also be injected subdermally, and this is an example of staging of lymphedema or dysfunction of the lymphatic system, where you inject the indocyanine green dye subdermally, the subdermal lymphatics pick it up, and then you can actually watch in real time how the lymphatics are pump or propelling the dye. So you can use it for both perfusion and lymphatic assessment. This is actually an article I published with my cousin Joe Dayan, who's a well-known lymphatic specialist. He's a microsurgeon on the East Coast. And I was actually in my general surgery residency when we published this, but at the time they were doing lymph node transplant, where they were taking lymph nodes for the groin and transplanting them to the axilla for breast cancer-related lymphedema. And we were using indocyanine green at that time to map out the lymphatics and avoid lymphatics that were draining the lower extremity. So I decided to apply this technology to radiofrequency and answer the question, are lymphatics being damaged? Is perfusion being damaged? And so this is an example. This is a camera I built actually. I'll show it to you. There's a filter on this camera that identifies the fluorescent dye that I injected into the web spaces of my hand. And this is a light source that excites the indocyanine green that gets picked up by the camera. And here you can see the lymphatic channels of my arm as the dye is propelling through the subdermal lymphatics. So we actually have used this camera for many purposes. We recently published an article in the Aesthetic Surgery Journal actually discussing filler-related complications, where we find that fillers, especially in the tear trough area, can create lymphatic obstruction long-term. And as a matter of fact, Morpheus 8 we identified as part of the solution to this problem because radiofrequency upregulates vascular endothelial growth factor pathway and upregulates lymphangiogenesis. So actually what we found at the conclusion of this is that lymphatics are actually stimulated and angiogenesis is actually stimulated by radiofrequency heat through the vascular endothelial growth factor pathway. And therefore, radiofrequency actually has much more benefit than just soft tissue contraction. It's regenerative in multiple ways, including perfusion and lymphatics, rather than damaging. And in the article that we published with Kami Parsa, who really was the person who came up with the whole protocol, Morpheus is used to improve the lymphatic flow of tear trough related hyaluronic acid edema. This is our 30-year-old patient. So you see this patient, we injected indocyanine green dye, and you can see how the dye is pooling where the filler was injected, which indicates that there's a lymphatic obstruction in that area. And even days later, in a normal control case, you don't see any of this pooling. You just see a little black dot and the normal lymphatic channel. So lymphatics are interesting. There are superficial lymphatics, there are deep lymphatics, and there are areas of the face which are considered watershed areas, especially in the periorbital area. The lymphatic channels, it's actually the only place in the body where there are no valves and there's no real directionality. So those areas are particularly delicate. And we actually published this article, I believe it was in 2019, looking at lymphatics and perfusion using BodyTite, FaceTite, and Morpheus. And, BodyTite and FaceTite have been really staple technologies, but they're fundamentally different from quantum. And the main difference is they heat at a lower temperature for a longer period of time. So normally with BodyTite or FaceTite, we're treating at about 68 degrees Celsius internally and 38 degrees Celsius externally, as opposed to quantum, which is firing for a fraction of a second at a very high temperature. So the time-temperature relationship for these devices is different. And when we looked at BodyTite, FaceTite, AccuTite, and Morpheus, we used the SPY camera and we identified that not only is there no injury to lymphatics and perfusion, which we didn't believe that there was, but the data showed that actually there's probably upregulation of those channels, which has benefits. The other thing with those technologies, because they're bipolar, there's an external electrode and an internal electrode, we know that majority of the heat travels half the distance between these two electrodes. And therefore, most of the subdermal perfusion and lymphatics are actually somewhat away from the maximal zone of heat, and therefore are not affected. We looked at Morpheus, which was actually very interesting because there's different depths and different energies. And what we found when we injected the dye subdermally is that, I don't know if you can see this, the Morpheus needles would actually pick up the dye that was injected here. And then if you look closely, you can see that the lymphatics pick up the dye and continue to propel. So even throughout the treatment, the lymphatic channels are actually peristalsing and moving the dye towards the lymph node basins at the base of the neck. Now, the Ignite RF platform involves quantum and then Morpheus, which has advanced software to provide more efficient soft tissue heating and just more options as far as how you can treat the soft tissue. In addition to FaceTite, BodyTite, turbo devices, and standard devices. So when we're looking at quantum, there's two handpieces. In my practice, we're really loving quantum for a number of reasons. First of all, we have two handpieces, the 25 centimeter and the 10 centimeter. They are bipolar, so the energy is moving between these two poles at the tip of the device, and there's a spacer in between. So it's bipolar technology. Now, the difference with quantum is there's no temperature, there's no thermometer on it because the energy is being delivered at a high temperature for a short period of time. So the heat is pulsating at 250 milliseconds at its maximum pulse width. And so that's fundamentally different from how face tight and body tight or acutight are delivered. Morpheus has also undergone changes. So now we have the scale and burst technology. The depth for the standard Morpheus headpiece is up to 5 millimeters, and then for the body is up to 7 millimeters. Excuse me, scale technology means that the energy is decreasing as the device is firing more superficially, and burst technology means the energy stays the same as you treat at different levels. So there's a lot of customization now that you can do with the software of Morpheus as well. So we wanted to look at lymphatic function and perfusion with this new Ignite technology. Another thing to mention with Morpheus is as you increase energy, your zone of injury increases as you would expect. So as the energy goes from example from 20 to 40, your coagulation zone increases, your area of coverage increases. And this is just another schematic of that. So there's an ablation zone, a coagulation zone, and then a zone of heating. So we wanted to look at different energies, how Morpheus performs, how the lymphatics and perfusion are. And to me, this was a very important study because, the problem in aesthetics, I think, and just having been to many meetings, is there's a lot of dogma, there's a lot of kind of repetition where someone hears something and repeats it, and then it kind of becomes a matter of fact. And I think it's very important for us to take a step back, really look at the science and understand, is this damaging? Is this regenerative? Which one is it? And that'll help us become better providers and safer providers. So here you can see on this histology slide, this is where the Morpheus zone of injury was. And then actually there's another histology slide showing that this ultimately realigns collagen, elastin, and thickens the collagen. So here's some of our data on this quantum face and neck ICG assessment. So I'm going to play this video for you.
So it's quite minimal access for the effect that we're going to get. It's really one of the best non-excisional skin tightening treatments available.
So here we're tumescing the neck.
Be about 200, 250 cc's of tumescent fluid.
So I like to do all these cases under local anesthesia. I felt it's very, very well tolerated. For the face and neck area, we make a little access point just inferior to the ear lobule. We start with 1% lidocaine with epi, just a couple cc's, and then we tumesce each side of the neck. And then we make another little access point in the submental space and then tumesce the central neck. Usually about 200, 250 cc's. The mix that we normally use is about 40, 50 cc's of 1% lidocaine with epi per liter. It's very comfortable, very well tolerated for the patient.
Preplatysmal, pre-SMAS plane.
We stay preplatysmal, pre-SMAS. It's a natural plane. Here, this is the Quantum 10.
So this is the quantum device. It comes in different sizes. This is a smaller handpiece. And this is the latest radiofrequency bipolar technology for skin tightening. And what's unique about this device is the two poles are on the internal cannula, and they're going to create radiofrequency heat that stimulates neocollagenesis, elastin reorganization, and ultimately soft tissue contraction.
So this is still a bipolar technology. The energy is moving between the poles, and there's no temperature monitor because the pulse width is very short.
So we are going to start off on the patient's right side of the neck area. And we're going to place the device. We're going to pre-tunnel, make sure we have a good path here. Are you feeling anything there, Maria? Okay. And then this is foot pedal activated, so we're going to go ahead.
So we treat it at 1 centimeter intervals, basically 1 centimeter per second intervals, row by row.
Centimeter at a time.
So we just go run one row at a time. We can see actual contraction.
We can really see some immediate soft tissue contraction, more so than the previous radiofrequency devices. So this is
we did the same thing through the submental space. 1 centimeter per second, basically, row by row. We're preplatysmal. And then we injected indocyanine green dye intravascularly. And you can see how all the perfusion is maintained. The only areas that are a little bit dark are where we saw where we injected the 1% lidocaine with epi because of the epinephrine. Then we did the same thing with Morpheus on the same patient. We
So here
normally
we can
did,
really appreciate how the Morpheus got into the subdermal space, picked up the indocyanine green dye. And if you look closely, you can see lymphatic channels propelling the dye, which demonstrates that there's good lymphatic function.
okay. Now here you can see in saline, you can see this basically reaches boiling temperature, but for a fraction of a second. So it's actually quite safe to use, even at more superficial depths than we would see with face tight, for example. We did the same thing for a body case using the Quantum 25.
Traversing between the two poles at the tip of the device. So we're going to be treating this patient's abdomen and flank area with the Quantum to tighten the skin, and then we're going to follow it with liposuction. So this device works rather quickly.
It is a very quick treatment and a very effective treatment.
2 mm access point. We've already tumesced the abdomen.
So similarly, we move it about a centimeter a second, row by row. And similar to the face case, here you can just see the actual technology.
Vaporizing the saline.
Bipolar technology.
Put it on the abdomen.
We injected the indocyanine green intravascularly.
You can,
and here you can see maintained perfusion
within 30 seconds
throughout the abdomen. So this confirms that there's no perfusion compromise. And then similarly, the lymphatics are working. So in conclusion, I think it's very exciting to see new technology with the Quantum in terms of higher temperature, which is safe, doesn't involve the use of gas or plasma, which has had numerous issues, where we're able to get high temperatures in a bipolar controlled fashion for a fraction of a second, maintaining lymphatics, probably upregulating lymphatics and perfusion, as well as neocollagenesis, both for Morpheus as well as the Quantum technology. So I'm happy to take any questions. I see that there already are a few questions here, which I'll open up right now.
Yeah.
So,
You're welcome to read them or just go through
sure.
them.
Yeah, great. Okay. So first question from Gerald, are rates of marginal mandibular neuropraxia lower with Quantum 10 versus FaceTite Turbo? It's a great question, actually. And I'll tell you, marginal mandibular neuropraxia can be an issue when you're heating, of course, by the DAO, because the marginal mandibular nerve comes up and becomes superficial in this area. I can tell you, we published an article a couple of years ago. It's the largest series of face and neck cases. The rate of marginal mandibular neuropraxia is a couple percent with FaceTite, maybe 2%. Normally, how we avoid that. So first of all, the issue here is that you're right at the pre-jowl. And one of the ways we avoid that is we over tumescent this area. So tumescent is your friend. Tumescent not only acts to help conduct the radio frequency energy, but it also acts as a heat sink. So more tumescent is helpful in danger zones. So we over tumescent this area to kind of absorb heat more efficiently to avoid spread. And secondly, we draw a line kind of diagonal from the DAO to make sure we do not heat this area so we can avoid marginal mandibular neuropraxia. In my practice, I've done a lot of Quantum with really nice results. I think I have not seen a marginal mandibular neuropraxia from it. I think with high temperature, short heating, it's less likely, but we'll see over time. But thus far, it's always something that we include in our consent. It's certainly a possibility. You can get a marginal mandibular neuropraxia even with just liposuction if you just bang up against the marginal mandibular nerve or traction on the nerve. But I haven't seen it with Quantum yet. I think it's going to end up being safer in that regard. And I am less concerned about overheating that area because it's a high temperature, short period of time. So things are not volumetrically heating in the same fashion. Patient selection for Quantum body tight, Quantum face tight. It's a great question. And actually, I was at the InMode Summit in Sardinia, which was very well attended. And this was a real hot topic because as quantum came out, everybody wants to know, how do we position it? How do we use it? And I'll just tell you my perspective on this. There are some clinicians that are shifting towards quantum primarily. It's fast, it's safe, it provides good results. And I think that's all very true. To me, I actually think patient selection is the most important part of radiofrequency treatment. So I can tell you, just having spoken to colleagues and gone through trainings, whenever people have underwhelming results, usually it's patient selection. So if you have a patient with too much skin laxity, is really an excisional candidate, should have had an arm lift, abdominoplasty, facelift, applying radiofrequency is oftentimes not the right answer. Now, if the person is willing to accept a more modest result and an excisional procedure is off the table for them, but they're willing to accept a 20-30% improvement, then fine. But the patient expectation has to be right. For me, my go-to, normally I'm looking for a patient that has some fat because I know that the liposuction is going to make an improvement on its own. I add radiofrequency for improved soft tissue contraction. And in the ideal case, I'll do quantum with lipo, either of the body area or the face and neck area. Now, if I have a patient that's really borderline and I'm really depending on the radiofrequency to make a meaningful difference, I'm crossing my fingers that we're going to get enough soft tissue contraction. I'll actually use body tight or face tight for the purpose of deep heating because the body tight, face tight handpiece, the internal cannula, is gliding over the deep fascia. And we're heating the fibroseptal networks that are connecting the fascia to the soft tissue envelope. That bipolar energy is bringing in the fibroseptal networks almost like a parachute. The quantum device is heating at the superficial fascial level. So it's a different layer of heating and it's a different time temperature relationship. And therefore, I'll use both because I'll use body tight, quantum, and Morpheus because it allows me to heat the fibroseptal networks, the superficial fascial system, and then the Morpheus allows me to generate some heat in the subdermal space, and there and the underside of the reticular dermis. So between those technologies, I'm able to layer the heat, and I think that gives maximal soft tissue contraction safely. Any other questions I can answer?
I don't see any in the Q&A just yet, but I had one for you. Last
Sure.
week, we were with Dr. Franco, and he was talking about quantum RF and GLP-1 patients. Just curious, your own thoughts on using quantum RF and Morpheus 8 for those types of patients.
Yeah, great question. So I'll tell you, the whole GLP-1 movement has been great for plastic surgery. Many more patients are coming in with soft tissue laxity. As we know, when the volume deflation happens, there's laxity normally in the submental space, really bothers people, arms, thighs. Many people do not want big time excisional procedures. And I actually think the earlier we apply these technologies in the weight loss process, the better. So what I try to tell patients who are in the process of losing weight, I'll tell them, the radio frequency can be cumulative. We start off with a series of Morpheus during the process, improve the soft tissue contraction. It's always better to do it gradually than lose 80 to 100 pounds and kind of deflate quickly. So I think ideally, the more gradual the weight loss is and the more gradual the radio frequency is applied, you can apply this different ways. You can start with a series of Morpheus throughout the process and then end it with a quantum towards the plateau of weight loss. And I think that's been really effective for our practice. And our patients, the nice thing about radio frequency is when patients have kind of big time excisional procedures, they're expecting a lot. The cost is high, the downtime is high, the incisions are long. And so the expectation is that you're hitting 100% and 90% isn't good enough. With radio frequency, I think people understand that there's some trade-off between invasiveness, power of the device. It's not equivalent to an arm lift. It's not equivalent to an abdominoplasty. And therefore, the patient expectation is much more reasonable, and we're able to hit their satisfaction more reliably that way.
Brilliant. We actually got three more questions while you were explaining that.
Perfect.
I think the first one is from Kelly.
Sure. So can you share some treatment plan for treating malar edema in conjunction with the under-eye treatment by Accutite? Yeah, there's an article that I published with Kami Parsa in the Aesthetic Surgery Journal, kind of really outlining the protocol. Kami calls it the FARI procedure, post-hyaluronic acid recurrent eyelid edema. And basically, it involves the use of Hylenex, Morpheus 8. You can use Accutite, but the idea about radiofrequency is that it upregulates the vascular endothelial growth factor relationship, and therefore improves lymphatic flow as well as perfusion. It may remodel any kind of existing filler in that area as well. But the article really goes through kind of the whole treatment protocol. The next question is, do you do lipo first and then quantum as a final step? Interesting. With body type, face type, I would always do the radio frequency first. And the rationale for that was first of all, the tumescent is in place, the fibroseptal networks are maximally extended, and the tumescent helps not only conductivity, but also safety, where it acts as a heat sink. So that's what I do with body type, face type. I always do the radio frequency first. With quantum, you can do it either way. I have started doing it after liposuction. It's a very safe technology in my hands. I think that the short pulses of heat are very helpful in the time temperature relationship. So you can do it before or after. I would say when you're getting used to the technology, because it's a new technology, maybe do it before. It gives you a little more runway because the tumescent can act as a heat sink. And then as you get more comfortable, you can do it after safely. Another question, understanding the relationship with energy and tissue response with Morpheus. Have we experienced papillary scarring with persistent dot patterns with deep? So, what I have noticed, Morpheus has been around for a long time now, and it's the most successful radio frequency device, fractional radio frequency needling device on the market. I think the body radio frequency, the body Morpheus device, you have to treat with care because the larger, the 40-pin headpiece is significantly more powerful than the 24-pin. And so if you stack energy on each other, the tissue will accumulate heat much more quickly. And so you have to be, I have not seen scarring with that. I have seen other cases of other providers with hyperpigmentation, especially in darker skin type patients. So you want to decrease the energy, especially as you become more superficial in darker skin type patients. But I would just say, the body Morpheus device, be a little more conscientious of the energy and stacking heat versus the 24-pin Morpheus handpiece, but I have not seen papillary scarring from it. Can you over-tumesce with quantum? I think the answer is probably yes. I normally over-tumesce in general, and I think it keeps you safe, and it also, tends to be effective. I normally tumesce like a 3-to-1 tumescent mix, like a super wet or tumescent technique, just like you would for liposuction, and that works very well for me. I think the tumescent helps with conductivity. I think it helps as a heat sink. You're much less likely to have a thermal injury, so I like that. What does the clinical data show in terms of improvements in laxity as well as fat destruction? Okay, so good question. Actually, Alfredo Hoyos has some data. He has basically an elastometer, and what it is, similar to those suitcase weighing devices, there's an elastometer where you put a suture through the skin and you can assess the elasticity of the skin using a suture. And what they've shown is significant improvement in skin soft tissue laxity. Fat destruction, this technology does not meaningfully diminish fat. So it's not really primarily used as a fat reduction technology. We normally use liposuction for that. But I do believe that quantum hasn't been around for 24 months yet, but we are getting longer term data that we'll be able to share. And we have an article actually coming out that we're in the process of really looking at the efficacy of quantum specifically in the submental space. How soon would you consider repeat sessions of quantum in face versus body areas? Normally, I wouldn't do it before 6 months. We normally tell patients that, the radio frequency, one of the downsides is it takes about 6 to 8 weeks for it to start working. You have to think of it as if you're kind of kicking off heat-induced injury or cascade. And so normally I wouldn't repeat it for at least 6 months. The other thing is the soft tissue needs time to kind of soften. But the other thing to mention is the treatments are not necessarily additive. So doing a second treatment doesn't always give you the same effect as the first one. It's most likely to be a little bit less effective. That's just what I've seen.
Okay. Oh, I think we got one more.
One more question. So essentially, quantum is closer in usage to plasma speed as a. So yes and no. So the concept of plasma, like if you looked at Renuvion J plasma, it's basically like a helium blowtorch and it's monopolar. And we actually did a side-by-side comparison published in the journal Plastic and Reconstructive Surgery, looking at face tight, body tight versus the plasma technologies. There have been a lot of issues with plasma. You know, the gas has been shown to embolize. There have been problems with that. I think from a time temperature relationship, yes, there's similarity where the temperature is high and the period of time that it's heated is short. But this is actually a much safer technology and it's bipolar in directionality, so the heat is more concentrated. Can you fat transfer after quantum? I have, and I haven't had a problem with it. It works well, actually.
Okay. Any final questions from anyone in the chat?
There's one more question here. Are you seeing lipodystrophy issues with quantum? No, I don't see any issues. I've actually used it in post adipose, post PAH, paradoxical adipose hyperplasia. It's worked very well. I don't see any issues with lipodystrophy. You can use it in lipo after and fat transfer even, and that all works very well. It's actually worked very well in buttock area, banana roll area, axillary rolls. I really like the quantum for that. It's been a significant change. You know, a lot of times an aesthetic device company comes up with like kind of the next generation and it's kind of a very incremental change. This is a fundamental improved technology that just didn't exist before.
Okay. Well, if we have no further questions, Dr. Dan, thank you so much for your
Thank you. Thank
insight.
you very much.
Yeah, it was a great chat today. And thank you to everyone joining. As a reminder, a full recording of today's session will be sent to your inbox and available on InMode University. Not that we didn't get to your questions, but if you do have any questions, please feel free to email us and we'll get Dr. Dan to answer them. Thanks again for spending time with us, and we'll see you next time.
Thank you very much.